Hi everyone, in the last lecture I have completed with the introduction, parts, layers and lastly pleural recess. In this lecture I will be starting with the blood supply. So let's get started. Blood supply. Blood supply of pleura. तो फर्स्टली हम देखते हैं पैराइटल प्लेरा. प्लेरा कितने टाइप का था? दो टाइप का, एक पैराइटल प्लेरा एंड सेकेंड इज visceral pleura. So first of all, blood supply to the parietal pleura. Intercostal artery, internal thoracic artery, and lastly musculophrenic artery. And second will be the visceral pleura. The blood supply to the visceral pleura is bronchial arteries. Bronchial arteries, because it is in close relation with the visceral organs. It means it is in close relation with the lungs. It is firmly attached with the lung. That's why bronchial artery supplies to the visceral pleura. Next is venous drainage. So in this part also, first is parietal and next is visceral. So parietal pleura, veins mostly drain into the azygos and internal thoracic vein. That is azygos vein and internal thoracic vein. It is mainly corresponding with the arteries. जैसे हमने देखा था इंटरनल थोरैसिक आर्टरी, सो इधर आप डायरेक्टली लिख सकते हैं इंटरनल थोरैसिक वेन. ठीक है. इन विसरल पार्ट इट इज मेनली सप्लाइड बाय ब्रोंकियल वेन. ब्रोंकियल वेन्स. ठीक है, ब्रोंकियल वेन. नेक्स्ट इज लिम्फेटिक ड्रेनेज. Lymphatic drainage. In this part also we have divided into the two parts, parietal and is visceral. Parietal part, it is mainly supplied by mediastinal node, nodes, diaphragmatic node, and intercostal nodes. In visceral part, it is bronchopulmonary lymph node. Bronchopulmonary lymph node. Then next point is nerve supply. Nerve supply. So in this part also we have divided into two parts. First is parietal and second is visceral. The parietal part It is mainly supplied by somatic nerves. Somatic nerves, that is intercostal and phrenic nerves. Intercostal nerves and phrenic nerves. And visceral part is autonomic nerve. Visceral part is autonomic nerve, that is mainly supplied by vagus nerve. You can directly write vagus nerve. If you don't remember, you can directly write with the vagus nerve. Then next point is clinical aspect. Clinical aspects. First is pleuritis. Pleuritis. The word itis means inflammation. It means inflammation of the pleura is called as a pleuritis. Inflammation of the pleura. Inflammation of the pleura. Inflammation of the pleura is called as a pleuritis. Then next is pleural effusion. Pleural effusion. Pleural effusion. Pleural effusion means collection of fluid in the pleural cavity. Collection of fluid in the pleural cavity. Next point is pneumothorax. Pneumothorax. Pneumo. The word pneumo means space. Space means collection of air. Collection of air in the pleural cavity. And next point is hemothorax. Hemothorax. The word hem means blood. Means collection of blood in the pleural cavity. Collection of blood in the pleural cavity. Next point is hydropneumothorax. 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 The word hydro means water. Pneumo means air. Okay? The collection of both fluid and air. Collection of, it means the collection of both air and fluid. And next point is empyema. Empyema means collection of pus. Collection of pus in the pleural cavity. Lastly, paracentesis thoracis. Paracentesis thoracis. It means there is a condition. कभी क्या होता है कि मान लीजिए प्लूरल कैविटी में प्लूरल जो स्पेस होता है उसमें अगर फ्लूइड मतलब एक्स्ट्रा अमाउंट ऑफ फ्लूइड अगर फिल हो जाता है तो कंडीशन में क्या करते हैं नीडल इज पास्ड थ्रू द थोरैक्स रीजन. ठीक है, नीडल इज पास्ड. ठीक है. Lastly, there is an important question. Differentiation between the visceral and parietal pleura. Visceral and parietal pleura. Visceral and parietal pleura. So first point will be it is thin. Sorry, parietal pleura is thick. It is thick. Visceral pleura is it is thin. Next point is it is loosely attached. It is loosely attached. And it is firmly attached. It means parietal pleura is easily identifiable. It can be easily identified, but visceral pleura cannot be identified easily. Parietal pleura, it has four parts. It has four parts. That is costal, diaphragmatic, cervical, and lastly mediastinal. The visceral pleura does not have any parts. It doesn't have any part. Next point is parietal pleura is the outer layer. It is outer layer. It is inner layer. Parietal pleura is sensitive to pain. Pain sensitive. And visceral is pain insensitive. Pain insensitive. And lastly, one point. Parietal pleura has somatic innervation. Means somatic nerve supply. It has somatic innervation. And it has autonomic innervation. So we have completed with this topic. मेनली इसमें क्या होता है या तो आपको डायरेक्टली शॉर्ट नोट आता है मतलब LAQ आता है 10 मार्क के लिए. So you have to write up to clinical aspect. And एक क्वेश्चन होता है वो क्या होता है distinguish between means difference between visceral and parietal pleura. It can come for 5 marks. So we have completed this topic.